And the question is, what is eczema or what is dermatitis? And to many young parents, they get upset when their young beloved baby diagnosed with eczema at the age of around 6 to 9 months of age. Self-diet manipulation, and this is not recommended by most of the international guidelines on eczema or authorities. And the reason why they practice self-diet manipulation, because these are the method or measures recommended by some of the unofficial eczema websites or the uncertified natural or traditional healer that strongly promote their program, like 21 days breast milk or blood detoxification program, and claim that if you follow their program, after 21 days, their kids' eczema will get cured and they live happily ever after. Of course, after a few cycles of 21 days of practice, the eczema keep coming back, then the parents give up and come back to this more scientific-based Western medicine that what we're going to introduce in this program. Eczema simply means skin inflammation because of the environmental insults. To be more precise, the inflammation is mainly over the outer layer. Our skin has 3 layers. The outer layer is epidermis, the middle layer is collagen layer, and the deepest layer is our fat layer. And fortunately, the fire of inflammation in eczema is mainly over the outer epidermis and part of the superficial dermis. And in fact, this is a good news because our epidermis naturally possesses the capacity to fully regenerate over 4 to 6 weeks. After damage, if you offer our epidermis an ideal environment, over the next 4 to 6 weeks, that would fully recover. And this is what we call it the epidermal healing cycle. In other words, if your baby develop eczema over here, over the next 2 to 4 weeks, you use either steroid or non-steroidal like tacrolimus and pimecrolimus and put the eczema into remission, and you use regular moisturizer, no more further insults. Over the next 4 to 6 weeks, the skin will back to normal. Although among the skin of color patient, they might have a bit of discoloration, but if you keep maintaining the well-being of the skin over here, over the next 2 to 3 months, the skin color will back to normal. Over weeks, months to years, the skin will progress from early eczema to chronic lichenified eczema, in which the skin gets darker than the surrounding skin, thicker over time, and a ladder-like textures over the affected area. And bear in mind, eczema is not only affect the physical well-being of the child, they also affect the psychosocial, mental, financial, and personality of the child, as well as the other family members. A child with chronic eczema, that poor quality of sleep, that could not perform well in the school or at work, they start to have this self-isolation and poor self-confidence, their personality problem. In fact, some of them may start to develop suicidal thoughts because of the intense itch that accompany a child with eczema, especially among the adolescents with eczema. And among the eczema kids, some of them will march on to other systems, which we call it allergic march, and manifest with rhinoconjunctivitis, asthma, and other forms of allergic diseases.